Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. Who gets to be a doctor? Normally, it's not young men and women who grow up in underserved communities and rarely, if ever, have a physician as a mentor. For them, getting an MD can look as unlikely as taking a vacation on Mars. But at Brooklyn Hospital, Healthbeat's Fred Brown found two young women who one day, thanks to a program that helps hundreds of young New Yorkers of color, may graduate from medical school despite the odds.
Well, there's like 4 or 5 of them scheduled. I'm going over to this side.
Okay.
The teen wellness program, first of all, has been in existence here at Brooklyn Hospital for about 4 years. We have been partnering with high school students who are interested in pursuing careers in medicine.
Ever since I've been younger, I always wanted to become a doctor. My goal in life is to open up a clinic where my parents are from in Ghana. And so I really feel like the medical path would lead me to that. Well, I'm part of this program called Prep for Prep, and they help match me because they know I want to become a doctor in the future. It definitely matters to me. Just seeing someone who's come from where I've been through, kind of facing the same challenges, it kind of reinforces the fact that I can do this, I can get through this. Like Dr. Hayes, I want to be like her when I get older.
Prep for Prep contacts me with candidates that they think would be a fit for our program. We specify we want someone who is interested in pursuing medicine as a career.
Many of these young people have no opportunity for the kind of exposures that I think they'll benefit from outside of this context. So I feel that that's one of the reasons I work in Brooklyn. Even though I have the opportunity to work in Manhattan, Long Island, and elsewhere, I still believe we could be of great service to the people of Brooklyn and whatever we could bring. And the best model you could do is to let them see what's available, let them see what's possible. We have Miss Mosley had a bariatric operation, which is a surgery to lose weight. Okay. After losing weight from the surgery, when they get pregnant, as you know, pregnancy is something that make you gain weight. So her challenge is to make sure she's able to eat enough to sustain herself, but also to help grow a baby. You've kept up taking the multivitamins that we've given you from the surgery? Yes, I take it every day. Okay. Do you have any complaints now that you're pregnant compared to before the pregnancy?
No, I don't.
Mentorship is pretty much just having someone that's there whenever you need them for advice, for guidance through this difficult process of becoming a doctor, hopefully a surgeon also. And just having someone that's been through the process and that's excellent in their field is all welcomed.
Okay. Everything is normal, so they did a more intense, a detailed exam.
What I would like to request is the next time the obstetrician takes some blood work, ask them so that they could send it to us so that I don't have to repeat your blood test, because it's important I follow your anemia.
Okay, I can get a copy sent to you.
Okay. You know, anytime you commit to something, you like to see the results, and I feel that this one is really, it's practical, it's tangible. As a student who was here 3 years ago, who was a high school student at, let's say, 14 or junior high, and you see them 5 years later, it's just really satisfying to know they're on track, but they're also willing to come back and work with us and mentor, so to speak, the next generation.
Many kids are discouraged. Many kids feel that this is not attainable. I grew up in Harlem. I did not have college-educated parents. I had hardworking, blue-collar parents. But one of the things that they continuously told me was that I could do and be anything that I wanted to be. So I hope that the message for Sheikah is that regardless, no matter how hard it gets, no matter how many exams that you may feel you could have done better on, no matter how many experiences when you're sometimes told or you're given the impression that you're not the physician, that you're the phlebotomist or you're somebody else, it doesn't matter.
This program grew out of my personal philosophy, of really two things. You need to give back, and giving back, I feel the secret of success, this is something I learned as a young person, is to find a mentor and imitate that person.
As Dr. Hayes was saying, she came from Harlem, and she didn't have that opportunity to go into a hospital setting. She didn't have that mentorship prior to her starting medical school. The earlier you start on a program and on your path, I think the easier it is, because once you solidify your goals, then you can really focus on it and you can achieve it.
I'm a first-generation American. My parents never went to college. They don't know the process. So sometimes it's hard to find people who understand that and are willing to be patient and teach me. So I would just like to thank you.
Absolutely, absolutely. Absolutely.
Become a fan on Facebook, like Brooklyn Independent Television.